program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor.
Hello and welcome everyone to Daily with Doc and Becca. My name is Ruth Ellen Sanchez. I'm going to be your host today. Let's go ahead and open up that Zoom room door and let everyone in. And today we have a really special guest on, Yvonne Rea. Yvonne is a functional medical nutrition and microcurrent pain specialist, board certified amino acid therapy for brain health. Former military, that did not come out as smooth as I wanted to. Former military, Yvonne has worked with Pain Free for Life beta testing research, where microcurrent protocols are developed, Erasing Pain holistic centers, where she assists in training interns and is a nutritional director. Team member at Theta Wellness Brain Health Center in Sacramento. And as an educator, she teaches weekly classes on nutrition and the use of frequency devices to expedite the healing curve. She also volunteers to work with other clinicians to broaden her scope of knowledge and research. Quarterly, she travels and presents the impact of nutrition and frequency devices for natural, alternative, and home pain relief. That is amazing. I can't wait to hear her story. First, I need to say this program is for educational purposes only. The content is not intended to diagnose, treat, or cure or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have choices. And that is why we have cool guests on like Yvonne to help you have choices. So Yvonne, I'm going to add you. Hello, how are you today?
It's good to see you all again. I'm glad that we're back at it.
Me too.
We didn't have another talk.
Yes, I'm very excited.
Yeah. Well, I appreciate you, inviting me back. I know today we're really going to be talking about lung health. And this would actually be part 2 of my docu-series that I've been putting together. And a lot of times people probably don't even think about this, but we breathe something like 20,000 times a day. And, the machinery that goes behind that, if it's not working properly, if it's, can't expand or contract back, there is other ensuing problems that will happen.
I'm looking forward to hearing all about this amazing process that you have.
Thank you.
So I'm going to turn it over to you.
Oh, okay.
Okay. And I have questions that intermittently.
Okay.
Okay.
So I think we have a few slides. Let me know when those are pulled up.
Okay. Give me 1 second. Lots of buttons here. All right. Slide 1 is up.
All right. Well, I'm going to have you jump to maybe slide 2, or no, go ahead and stay there. And we're just going to talk just a brief minute. I know that Doc and I think I've heard Ben talk about this too, but the fact that when we're talking about lungs, bronchial health, that can include any number of health challenges: bronchitis, emphysema, long haul COVID, asthma, and all of these have a nutritional deficiency component. And what can happen is if we are missing those nutrients, we now have these problems. What I have found is when we, if that isn't enough and you need to kind of come in and have an assistant, this electrical of the body, we can tap into. And so earlier I was just talking about, talking or breathing 2,000 times a day. If we really take a look at, how we can help our lungs, the first thing that we want to understand is, one, it's typically nutrition that gets us into trouble. That's usually the start of the symptom of a tissue issue. And when we look at this slide right here, the next step, if somebody is not getting better, let's look at the electrical component of the body. Now here, there's just a couple slides, and people often will ask, how do I check, the voltage of my tissue? This is happening in hospitals every day, and they're using electrical equipment to check several different parts of the body. One would be the heart. If anybody has ever had neuropathy, and they go in and their docs will actually test them. I think that one's called an EMG, electrical muscle stimulator, and they're trying to capture two things on that: not only the voltage, but also the heartbeat at the foot, because if something's going awry there, they're going to start to try to trace that back. And there's heart, brain, neuropathy. I know I'm missing something. Oh, kidneys. They can electrically try to determine information about kidneys as well. So if we move into the next slide, and that EKG real quick, that is, again, just helping the body understand where is there any electrical blocks or areas of resistance. And so we are using tools to do the same thing, but they're frequency specific. They're also tissue specific, but kind of an all-in-one. So one of the things that we first want to look at somebody with health challenges are how are those lung challenges affecting their O2 sats? Now, I did a little bit of research, and when we talk about O2 saturation, that's about the oxygen that is in the blood flowing through the body. We know, again, if there is not, regarding lung health, if there is not enough nutrients, you can begin to have a problem. And then if you take a look at the top, I think is, it talks about there is a website there, an NIH website, and there's over 120 reviews on this. I'd love for people to go in and just educate themselves, but it really discusses what Dr. Wallach has talked about before, the Keyshawn disease. There was also another name called the, and somebody correct me if I'm misstating this, there's Keyshawn, and the other one was Kishan, I-N, and that is a condition about the bones and the joints and the need for these specific supplements, which would be selenium and essential fatty acids. Has anybody ever heard of that one before?
Yes.
Yeah, pretty cool. And it's in here in this study that I've noted. So I think it's worthwhile to go in and check this stuff out. If we move into the next slide, one of the things that I'm trying to help do is during the beginning and mid 2020, 2021, 2022, we kept seeing people that were having all of these incredible health challenges that were lung related. And I wanted to try to get out the word that, hey, we can help with that inflammation, that swelling, that edema that's happening in the lungs. So one of the things I've done, I'm showing just a couple testimonials here of people that either are part of the lung study that I'm doing, or that came in, and with the study, it includes the nutrition. So we're using nutrition and the microcurrent together. My goal here is just to show or prove the efficacy in one treatment, how we can begin to increase the oxygen. What happens in the ERs is that they get so impacted and inundated, the only thing that they can really do in the moment is try to get oxygen on them, give them a steroid. But these tools, these protocols are, they're imagine one of the first at-home interventions is somebody using an inhaler. So I truly believe that if we can prove the efficacy of this through the clinical trials, or these clinical studies right now, they are set up for clinical trials, but we'll see what happens. We probably have close to 75. But here we have Kim. She came in and for over a year just couldn't breathe. And over the year, her health was continuing to fail. I did invite her on the call today, so I'm hoping that she may be able to make it and show up and actually kind of share her own testimony. But, you know, you can see that for over a year, she was struggling. And this is actually a video, but we don't have it running, so we can't have her tell her story. But with a few treatments with this, you know, she was just up and running again, and her health again was no longer on a downward spiral. So hopefully we'll hear from her at the end. Let's go to the next slide. And I think what we have here, I mentioned a little bit earlier. Oh, and here is where I think I have the link, but it's really incredible because with this, it's not only about essential fatty acids or selenium. It's not also only about lungs, but you'll see that, you know, muscle weakness, thyroid challenges, infertility, immune dysfunction can happen without just these particular nutrients. Obviously, we always believe in all of the essential nutrients, but take a look at these reports here. Let's go to the next one. Thank you. In our clinical trials, this gal here, she was on oxygen and basically was told that she would be oxygen dependent. One of her biggest challenges is that she could not go up into the high altitudes. Here in the Northern California area, we have something called the Grapevine. Also, if you want to visit, which is only about an hour and a half from us, these were challenges that she couldn't do. So getting over to Southern California, she was unable to do. You know, she retired, traveling was her dream. And someone told her about what we were doing at the clinic. The first thing we did for her was, as you guys remember, we've talked about hidden hunger before, right? That's where those nutrients, we can be overfed but malnourished. And that's what was happening here. So the first thing we started to address was the nutrition. And then shortly after that, we started the microcurrent protocols for her. And because this was going to be a long-term, you know, she did purchase a home device. A lot of people use these, much like the inhaler, as a first response to reduce the swelling, the inflammation, the stuff that's going on that is creating an episode for them. And you know, she now travels, it's pretty cool, over the Grapevine to Tahoe. But what is even more exciting is she is not needing her daily oxygen. And you know, she does keep it around as precautionary. But you know, these are the things, the body is also electrical. We're not just chemical, but we're also electrical. And that chemical needs the electrical. So if you're, you know, like me, I was utilizing all of the nutrients and I got significantly better, but there were still a couple challenges. And it was working on that electrical side that got me over that proverbial hump, and just moving me into a better state of health. Here, if you want to move to the next slide, we have Dr. Dom, and we'll have to try to maybe see if we can bring these or get these videos for folks. Here in his clinic, he does address long COVID, and he is an expert in, you know, just managing, understanding, and recovering from these syndromes. And we use the same devices and tools that he does. and he was a Army surgeon, flight surgeon, and just, is utilizing microcurrent. I think we talked about him in the first series of our docu-series, which was the spinal injuries and the incredible work that he is doing there with nutrition and with microcurrent. Let's see, what's our next one? So when we talk about microcurrent, I want to just first address, a lot of people will talk about a much older technology called the TENS unit. So microcurrent and electrical stimulation came on the scene back in the 1800s. So this isn't new, it's been around a while, but I wanted to make it clear that you do not want to use a TENS unit on the lungs. This is not what it was designed for. TENS do one of two things. They either, one, block a nerve signal, so there's no real resolve or regeneration. The second thing that they do is they're muscle stimulators. So do not use these on your lungs. And if you take a look at the chart, you get the opportunity to see a little bit about how they're different. Now, I call the TENS the screamer and the microcurrent the whisper. And part of the reasons are because, one, it does not yell at the body. It's actually, microcurrent is 1,000 times less than a TENS. The waveform is different. A TENS unit is surface. A microcurrent can get deeper into the body's tissues, and thus, being able to provide greater healing. And then the more that your blood is filled with those nutrients, because the microcurrent can help increase blood flow, Baylor and Stanford, I believe it is, says by up to 400% to the area that you're working on. If you have quality nutrition in the body, if you have any nutrition in the body, imagine this, that tissue issue that you're working on in the lung specifically, we're going to be able to feed that tissue up to 400 times more than it was able to eat without that circulation. And again, there's a little bit more to this, but that's why you got a little chart there for you. Let's move on to the next slide. You might remember in part 1 of the docuseries, Dr. Dom was talking about a lady with Guillain-Barré syndrome. And one of the things that had happened with her was that because of the nerve damage with the GBS, it was impacting her ability to breathe. And it was about 6 or 8 weeks after she started the protocol with Dr. Dom that she was able to, get back to health. And again, using the microcurrent as a first line of defense, but looking for not just a symptom relief, but that overall rebuild is what we really want here for people, right? Let's go to the next slide. And I started off just talking about, in 2020, 2021, working on this clinical trial. And you can see, here I am just, it was purely by accident, I got to be honest, what happened here. We were just offering free classes, and we took the protocols that we were using And we had 99% had an increase in their O2 saturation, their oxygen saturation. We tested 4 different ways before and after, gave them the nutritional drink. We did this very specific microcurrent protocol, helping to address inflammation, scar tissue, and then retested them again in those 4 areas. We had all but one out of about, I think it was around 50 or 60. We didn't get a change in his, in the tests that we did, but he said clearly the expansion and contraction of the lungs was much better. And that's been about 4 years ago. And he is, still touting this particular event that he attended and how well the microcurrent worked for his lungs. He ended up bringing his mom in for his knee and other things. But let's take a look at some of those other things that came out of this. And we're actually still working on this study, because my goal is that we would get 130 people that we can test, because there'll be about 30% that will be thrown out. If you want to move to the next slide. So we've been documenting oxygen saturation. So these are just some success stories. Now, what I want you to see in these pictures, if you can, these are afterwards, and we do have quite a few of these, but if you take a look, you can see the 98% on their O2, their SO, their saturation oxygen percentage, 98%. Now, I can't remember personally what they were when they came in, but for the clinical trial, the ones that will matter were those that were 95% or below. And so these two were pretty happy. Roy there, some of you guys might remember or recognize him, Mr. Happy Feet. And if you remember, he had 70% vascular insufficiency. And obviously, if he wasn't breathing well, that's going to impact the rest of the circulation in his body. So this was around 2020 for him. And then in 2021, we started working on the rest of the vascular system because of the damage that had occurred. They were actually talking about amputating. They just had not decided, were they going to amputate from the knees down or below the knee? And then we got Ewald, who is a construction, and he's pretty happy because he can go back to, he went back to work. Let's take a look at the next slide. Here we have a couple folks that have, you can see, whether the damage is caused by, virus, environmental, first giving the body the raw minerals, and then we add a little frequency to boost that ATP, increase the circulation, reduce the inflammation, address the fibrous tissue. We got a win-win situation. All right, what's next? Here we've got another one. Now here you'll see a little bit, part of the protocol also includes not only working directly on the lungs, and we use our tools. Some of you might recognize. Some people call this a magic wand.
They can't see you right now, so we'll show them after you're done with the slides.
Oh, okay. Thank you.
Unless you want me to show you real quick and then go back to the slide.
No.
Okay.
No. Okay. But what was I saying? I got myself lost. Sorry about that.
Oh, you were talking about working on the lungs and how you use your tools.
Yeah. So in this slide, you can clearly see, though, we're working on the meridian points. And so many will know about traditional Chinese medicine. Anytime you have a lung challenge besides nutrition, you'll hear consistently from Doc, from Ben, pharmacist Ben, meridian points, essential oils, nutrition. Utilize all of these things, layer them to help you through the challenge. Because a lot of people are unaware that if you cannot get the breath and the filtration happening within the lungs, it's a slow demise for the rest of the tissue. So it's critically important. It's not just about getting on oxygen. It's about figuring out how to reverse and then repair and eventually rebuild the tissue of the lungs. It is a filtration system, just like your kidneys and your liver. And so again, those meridian points are very key. Next slide. So with our clinical trial, on average, we have been able to increase the oxygen circulation by about 3.2. And that's actually pretty huge because, again, whether the damage is from, viral, environmental, whatever, we're looking at increasing that. And it's interesting because we actually continue to test just the oxygen saturation for the next 3 days. And the oxygen stayed in those upper levels. So that is really exciting. Again, the potential for an at-home, first response, keeping people out of the ER and keeping the impact of, our ERs are really oversaturated. It is a problem. And so my hope is that as we continue to build on this, that we'll be able to have more just find these tools. Let's go to the next slide. So here is just a flyer of the participation for the clinical trials. And you'll see a little bit next to it, we're talking a little bit about some of the hertz or the frequencies that we're going to use specifically on the body. So the beautiful thing about these tools is they will, one, address the specific tissue. So we're going to work on the lung, but then we bring in also what is the problem with that lung. And if you're looking at most lung challenges, it's going to be inflammation, which if stays too long, creates edema, fluid in the lungs. So the goal is to first start to drop that swelling, that inflammation. We touch every part, front, sides, back of the tissue. And then just, look to bring better health. What's that next slide? I think we're done. And then there's just a little way to contact us. Are you coming back on?
There we go. Yeah, it seems like I have to double click everything today. Those are fantastic. Great slides and great stories of personal, like, evidence of actual repair and health I'm always blown away by the microcurrent.
Well, and like you, I'm also blown away just by the nutrition. I mean, for those
Yes.
of you that are familiar with, rare earths, forbidden cures, Let's Play Doctor. I mean, very clearly, and these are not the only books where this information is stated, but these are great books because I actually have them in my clinic. There are books that I suggest to my clients as reading material because my goal is to educate. The microcurrent, as great as it is, it cannot rebuild the missing tissue. So we have to come in, and we created this, the marriage of chemical and biology and technology. We are electrical beings. The electrical is required to move anything chemical in the body. So if the body is low in voltage, you can really struggle to have something actually that you're doing get full benefit. Does that make sense?
Yes. Yes, it is, because it's very important to have the building materials, like you call it, the nutrients in there, because, you literally, I know for personal experience of going through something hard and then not taking my supplements and how awful I felt and couldn't figure out what was wrong. And then I realized I hadn't taken my supplements for weeks, and why I don't even know. But it made a huge difference for me. And in the beginning, when I first started with the longevity's, the Tangy Tangerine, the Healthy Body Start Pack, I was so sick prior to that and I couldn't get better. And it was just like this whole evolution took place, and I started to feel better. I started losing weight. My hair started growing in better, and my skin cleared up, and just a whole bunch of things. So we do have a couple of questions.
The return to life, right?
The return to life.
And it's really interesting, and just talking about, like, just say lungs or whatever you were dealing with. But, who was it that said it? Does anybody remember the Iceman, Utsi? This just made me think of this. They said that he had black lung, probably from all of the campfire smoke. And but when you say about your nutrition, we know that, like in the Keyshawn disease, that's selenium, good fats, the cystic fibrosis. From this, when it's not happening, we get a drop in oxygen, or like you saw a drop in everything, didn't you?
I did.
Yeah.
I really did.
And now, can I ask you a personal question?
You can ask. Yes.
Can I put you on the spot?
Sure.
Because I had this myself, and I'll share after you, but what happened that you, I'm going to use the word, forgot your nutrients? Because I know that happened to me. How do you this happened to me. How did I forget to take my nutrients? I was going through something, and I don't know if life just got too busy or if I felt overwhelmed. For me, it was about my bone health. And the inflammation that was occurring.
Right. There have been times I forget to take my medicine or vitamins, sorry, which I consider my medicine.
We could look at
I consider it medicine,
right?
Yeah. I suffer severely if I don't have it. So there are times that I just get really busy. One time I had to go away to work, and I completely forgot all of my supplements in my bedroom. And I felt it, and I had to order stuff to come in.
Yeah.
So mainly it's that. I mean, there was another thing that happened, and I'm not ready to talk about that publicly.
My apologies. Yeah.
It's
Okay.
all good. It's all good. Someday I will, but right now I'm just not there. But it's very important, and I know that it makes a difference every day to feed your body in a way that with America's food supply, there are almost no nutrients. And, people grow things in their gardens and different things, but if there's no calcium in the soil, you're not going to have it in your spinach.
That's right.
You can eat organic all you want, but you still need to supplement just because, they put those dams up so farmlands don't get floods anymore. And it doesn't stir up all the soil and take things from like way on top of the mountain down into the plains and different areas. So, like, how could we not feed our bodies like with nutrition? Good nutrition.
Well, yeah, well, and you and I are of the opinion, simply because of that whole hidden hunger at play, we recognize I'm going to play it safe, and we're going to take these because I recognize, just like you said, it's not in the soil. There are lots of other things in the soil that we don't want to be, even when we're eating, organic. That organic food is not any more nutrient dense than commercially grown food. It just has a little less on it. Being a survivor of Camp Lejeune, I am very, keen on that, trying to, keep things out of my body. But yeah, that's hidden hunger. That's exactly what that is. And we're taking in plenty calorically, but we're actually malnourished.
Yes, very malnourished. It's I hate to say this, but there are times that I look at someone and they weigh 500 pounds or more or less, they're over 300 pounds. And I just think, my God, that person is literally starving to death.
And they don't even know it.
And they don't even know it, because I had somebody say that to me.
And I now recognize and truly believe, it's, while there may be an emotional attachment, it's not an emotional problem. And I learned that when I got my certification for brain health using amino acids. So this isn't the only platform that truly knows. They're just focused on, brain health and how those amino acids, if they get low in the brain, you get mood swings, you get behavioral, and they do call it a chemical imbalance, because it is.
Yes.
And to try to feed that, remember, the body will take the lion's share of the amino acids, but the brain needs a lion's share. So if you drop low here, it's almost impossible to eat enough. You really do need to supplement with things that can help rebuild those neurotransmitters and reestablish, which most of those neurotransmitters, those are hormones. And if you don't have good fats, baseline of a hormone, right?
Yeah.
Anyway, sorry, we're talking about something else, aren't we?
No, it's all important, because I've been increasing my amino acids, and it's helped me significantly. So it's all good information.
And did you know that they're a natural anti-inflammatory?
Yes, I can tell you that for sure. I can tell you that.
I used to take something else, when I would have migraines. I no longer have the migraines like I once did, but on occasion I have gotten them, and I'll actually take an extra 6 or so, and that will usually be enough, along with some minerals, but that'll usually be enough. But I'm talking maybe 2 or 3 times a year now. It's nothing like it was before. It was 2 or 3 days almost every month.
So we do have a hand up, and we have a couple questions. So I'm gonna go ahead and ask Hattie to unmute.
Awesome. Thank you, Ruth Ellen.
You're welcome.
Oh, I apologize. I missed 13 minutes of your presentation, and that was 13 minutes too much information that I missed. So I'll go back and listen to the recording. but I'm really interested in this microcurrent. You know, I have because I have seems like for some reason I'm getting a number of clients that have severe issues with asthma, COPD, and it sounds like this is something that might assist. I'm also glad that you talked about the importance of the nutrients, because too many of my friends are in this thing. Well, if I just get a machine, I got a woman that's going through cancer. She's spending thousands on hyperbaric chambers and carrying on, but not the nutrients. And I don't think you cannot bypass the nutrients. They're too important. So I'm really glad that you mentioned that. But I would love to have more information about this microcurrent. If not now, I can get back with you later. And I want to know if you've used it around kidneys, i.e. getting people off dialysis. And how long does it take? What have you seen in your experience with people with COPD and asthma and all that kind of stuff? How long did it take to see a difference?
Well, I'm not sure if you saw our story. She was on oxygen when she came to us. And I would say it was for her maybe 6 months before she went from carrying the oxygen daily to keeping it with her, but not using it. And then I had a gal, Rose, 90 years old, told that she was going to be on oxygen. And she had quite the long lead that, went through her apartment. Well, we were probably 3 or 4 months. And she was able to she would go to the dining room to eat and come back 3 times a day, use her oxygen. But somewhere after the 4th month, she was able to not only just go to eat and come back, but she started getting, and she was engaged before, but she would go, like they'd go play cards or they would do whatever activity was happening at the senior community. And so now she could eat and do an activity without going back to the room for oxygen. So everybody's a little bit different. But I truly believe that it will ultimately be the nutrition. The microcurrent is wonderful. Without the nutrition, there are certainly people that are using this as a tool. There are practitioners like myself. We see people coming in. They're not purchasing a home device, which in my opinion makes more sense, cost effective. I even encourage my clients, if you want to work with me, here's how I work. It's a twofer. And, if they actually start on my rebuild program, I include a free session every month, because to me, the nutrition is that important. And I want to make that clear. And so they come in for a 15-20-minute session for those that are on the rebuild using the nutrition.
Awesome. I want to learn about the rebuild.
Okay.
Peace and blessings. So I can reach out to the email. I think you had it on a slide.
Absolutely. Or my website. I can say it here. I'm not sure what.
Yes.
Can we put it in the chat, Ruth Ellen?
Yeah, let's do that.
Yes, we could do that.
Thank you.
You're welcome. Thank you, Hattie. That is an amazing story. It made me think of my aunt, who had the long tube for oxygen, and I miss her a lot. I do.
So, and the microcurrent, it can help quiet that pain, that hunger. The tissue is, hungry for air. And we start to reestablish any potential resistance of electrical or loss of electrical or block of electrical, in the body. And because remember that inflammation begins to take the form of congestion, which then just creates another problem. So the earlier we can get it, the better, or I should say, in my experience, the faster somebody has that recovery, because we're dispersing the congestion and getting it, out of the body.
Yeah, that's very good. You got to get things out.
Yeah.
For sure.
Well,
So we go ahead.
I was just going to say, and I know you and I talked about this, and after you disperse the congestion, the what initially happens is those white blood cells, they're coming to the rescue, right? But the electrical will kind of signal, it'll give this move out, clearing of the white blood cell signals. They want to come and try to help, but it's kind of like the Battle of the Bulge. If you remember the picture of the Battle of the Bulge, the Marines, the soldiers were coming in and they were trying to establish and plant the American flag. And to do so, soldiers were dying and they were crawling over those soldiers. And that's kind of what's happening when you get inflammatory response that doesn't stop, much like fibrosis. In cystic fibrosis, you get scarring that just isn't stopping. The body almost goes into, over construction mode, simply because there's actually things that are missing. But we want to move out, or send out that move out signal, by removing the inflammation. And then those white blood cells, which the body's actively producing, people don't even realize, you got inflammation, you have an immunity challenge that's happening in the background in the bones. And the electrical can kind of come in and augment that.
Yes. Great. So we do have a couple of a question and a comment on YouTube. So Mr. Rod, who's out there on YouTube, says Yvonne's approach really works. I've personally experienced it for myself. She helped with my knee when I could hardly walk. In a matter of days, I was much better. Awesome. That's awesome testimonial. Very good. And then there is a 4-part question that
Let me write this down.
Yeah. Okay. I know. I would do that too. Because it says right here, it says, ask all at once, let her know it's a 4-part question. All right. So why would, are you ready? Okay. Why would someone get lung scar tissue? What can be done when using microcurrent? Why would there be tons of phlegm? I have an answer for that one too. Should a person expect to get better overnight, or will it take time?
You have an answer for that?
Why would there be phlegm?
Yep.
Yes, because the body is releasing things, and the only way to get stuff out of the lungs is to cough it up and get it out. That's my personal opinion. I don't know if it's accurate, but usually that's what that means. If you got something in your lungs and you're working on them, your body's going to release, just like if you were doing something else. You need to do foot soaks and different things too, and if you're doing a detox, the body is going to make you go to the bathroom a lot.
Yes. Yeah. Now I know just for the first question, it was, why would scar tissue do what?
Why would someone get scar tissue in their lung? It says get lung scar tissue.
Oh, okay. Well, what happens is the body's constantly trying to repair itself. And let's just start, like I said, with, the fact that first, there may not be enough nutrients for the body to help itself. And, you have the mechanism that utilizes the prostaglandins and nerve control. There's the vagus nerve that can be part of what may be going on. And so, you know, scar tissue, this might be better one for Doc, but ultimately the bricks and mortar to physically repair the lung matrix and the air sacs just isn't there, but the body's trying to repair it. And so you get, some call it an overactive, overactive tissue is what they'll say is happening. But we understand that to be working a little differently. And then what could be done? What could be done with what? I got part of the questions, but.
Okay. So it says, why would someone get scar tissue? Then it was what can be done for the lung scar tissue.
Oh, so remember we were talking earlier about frequencies. There is a frequency specific to scarred tissue, and we address it using that. And what it does, scar tissue, you know, you're looking at the fascia, and that's where the travels. If I've mentioned this before on YouTube, there's a wonderful YouTube video called Strolling Through the Fascia. If you get a chance, go take a look at it. But that fascia, when it begins to scar, it once had much like grain of wood. It had a pattern. But when it starts to scar, it looks more like a bowl of spaghetti. And so electrical can't come through that. It literally becomes like this beaver dam in a river. So what can be done, again, with the use of tools like microcurrent? And there are other ways that people have neutralized a scar, because the one thing about a scar is it becomes a conductor. So it becomes conductive, which means scar itself can be a reason for somebody's pain, because that electrical will build up. In class, we would go around with an ohm meter, and our Dr. Hache, said he had a gentleman who had so much power in his scar. It was something like, don't quote me on this, 1.4 or 7, or either way, it was enough to light a light bulb. That's how much he had in that scar tissue. And they did a treatment, about a 15-minute treatment. And not only did that electrical conductivity go down, but so did his pain. And then the phlegm is, it's the fluid that begins to build up. It's the swelling. It's the white blood cells. It's your body's trying to come help itself. They die off. Now they're considered toxins. And so you get this thing called edema. And oftentimes there's cytokines, and it's happening all in these little sacs, and the fluid builds up. And did I finish that question?
Let's see. Should a person expect to get better overnight, or will it? It take time?
Much like we talked about earlier, everybody's different, but the fact that there is a way that we can begin to restore and breathing is pretty phenomenal, you know, outside of using an inhaler, and it's a vasodilator, but it's not really doing anything to help the tissue. It's not addressing scar tissue or viral load, if that happens to be the reason for the lung challenge.
Okay. That's excellent. You did great. And I was wrong.
You were right on.
Okay, good. Very good. So we have a hand up, and then I had a couple questions that we can get to in a minute. Okay. So Bill, if you would like to unmute.
Great to have you with us again, Yvonne.
Oh, it's good to hear your voice. How are you?
Doing much better, learning more on using the unit. I just wanted to say that my wife and I, we went down in December in 3 treatments. We went through pain level up to a 12 sometimes, and we went down to a 4. We stayed there for 4.5 weeks. And rental is available from Yvonne. We rented that one for a month and then purchased one. And there are so many things that this can do. There are thousands. There are over 400 videos on learning to use these. So it's like, just go to our website, look at what can be done, like curvature of the spine can change dramatically as we stand up. Well, she's talking about the symphysis bone there, letting the nerves flow through correctly through your neck. It's just wonderful. I tell people if you slightly are out, especially your neck area, you hurt. But if you're out too much, you're actually paralyzed. And so these are not miracle machines. They're just light waves and sound waves and frequencies that God put in our universe. And we're harnessing those for the individual tissues, individual tendons, and everything in the body just works all together. It's just great. Go to the website.
Fantastic, Bill. I am so delighted that you and your bride are just feeling better and better. Keep it up.
Well, I appreciate that, but what people will ask, well, how long does it take? Is this going to take a week or two? No, it's taken me 74 years to feel as bad as I do. So can I expect things turn around on a dime? No, but let's be realistic. What is, work daily with it. Like the vagus nerve, one of the most important nerve in the body. We do those treatments multiple times a day, 4 times a day. Anyway. And there's other things that we need to do. Anyway, thanks for allowing me to share.
Thank you, Bill.
Thank you.
That's awesome. All right. That was good. I love to hear stories like that. And that's one thing that Bill said, that a lot of people, they just think, I'm going to do this, I'm going to be good in a week. I've had it for 35 years. I'm going to be good in a week. And it's like, no, it does. Even with nutrition, it takes time because your body has to release, repair, and in whichever cycle it does that, it took me a long time. It didn't happen overnight to get, lose weight, be able to walk. I mean, when I first started, I couldn't even walk. I wish I would have known you then. Oh my God, that was horrible. My leg would not bend. I was a limo driver for since 2010, and I started doing sedan work. And that is, I'm used to people being all the way back there, and instead they're right behind me. And I would go to the airport and pick somebody up, take them to an office building, go back to the airport, pick somebody up, take them to a different office building in a different town. And then I would go home, go to the first one, pick them up, take them to the airport. And sometimes in between taking these 2 people to and from the airport, I might pick up 3 or 4 other people. So it was, some days I put 300 miles on the car. And it was a lot. So I could have really used you. So you did say something about the electrical current in the scar. And that's why when I have a cut on my finger, I was washing a glass. Never wash glasses when you're mad. And it was one of those hourglass shape, and I put my hand in to get and I've done it 100 times, but I was really mad. So don't do it when you're mad. Don't wash dishes when you're mad. At least not the knives and the glasses. But I took off part of my finger, like I lifted it up from here to there. And I had to go to the hospital, obviously. And the bottom part was thin where it got cut. And by the time I was at the hospital, it that tissue had started to turn like black, like it was dying already, And so for several, I won't go into the story, but they were able to fix it, and that part, healed and everything. But for, I don't know, 5 years, if I hit it just wrong, it would send an electrical current up my whole arm. And I learned to be very careful. It doesn't do it anymore. So I think one of the questions was, and my phone keeps closing on me, is where is it? So you talked about scars having like a current. So how can I check my own tissue voltage? That's what it was.
Yes. So, well, real quick, just to, when you said something about, hitting that in the nerve, we have to understand the perspective that we are an electric body, or there's a book out there by Dr. Robert Becker, The Body Electric. And I'm just going to remind you a couple things. If you take a balloon and you rub it on somebody's head, you got static. If you scooch across the carpet, we are carrying that electrical charge. And but I'm glad that you got to recognize and the nerve is what we need for sensation and for function. And so ask your question again. Sorry, I got a little bit sidetracked.
No, it's okay. It's how can I check my own tissue voltage?
Oh, okay. Yeah. So that's a great question. When we started, I commented about there's several ways that they will test your electrical. And, we're not just a collection of parts, but there are, there's a circuit board, and healthy tissue has a very specific voltage that has been measured. This is information that is known. You can look it up. But to check the voltage of tissue, your tissue issues, we use these microcurrent tools with a biofeedback. And this is a closed loop neuromodulation. So not only does it reach the brain, but it comes from the brain back down to the affected tissue. And kind of like a EKG that we were talking about, ECG, they'll put 12 leads on you, checking your heart for electrical, going to the furthest regions and back. And are there any blocks, right? So, or like an ohm meter, your electrician comes and he's going to take 2 prongs, put it into the electrical outlet that maybe you're having the complaint with. Is it getting electrical from the box in the bedroom all the way to the back of the house to the breaker box and back? And that will register information for him. That's exactly what these tools do as well. So when I'm working with a client, this particular device has a dual smart chip. So it can calculate up to 3 million signals per second. These are not just random numbers. I think you've seen on some of the other ones I've shown, specifically you can see the impedance, the conductivity, the electrical blocks, and we just kind of start from there. We don't diagnose anything, but the goal is to try to raise that voltage back up. And over the next 3 or 4 days, the body will take that And it'll always drop back down a little bit. But as we do this a couple times, you're going to keep getting a little higher. And especially with the nutrition, it'll hold and you have the opportunity for rebuild. And I mean rebuild, not just repair where they're going to sew up that little, stitch. We know through regenerative medicine that we can rebuild tissue. I've seen some of these guys say you can go back as far as 5 and even 10 years in rebuilding that tissue. So, and that means if you've got a tendon issue, we're talking that it's, it's not, let's say it's all worn out and it's thin and it's too loosey-goosey, right? It's stretched and it's where you can rebuild that. So it's going to come back to what it's supposed to be: thicker, stronger, not so, it still have that elasticity. But again, most of this is all, and we should talk to pharmacist Ben about this, because it's mostly in the beauty industry, the regenerative use or the speak, and we're talking about, they call it anti-aging, regenerative medicine, age reversal. We've all heard of these terms, right?
Yes.
It's real.
That's amazing. So yeah, that makes sense, because you see on TV different devices that you can like run along your jawline and up your neck to like tighten it up without any kind of surgery and different things.
Well, and we heard Bill say earlier about light. What's really cool is when you, in the quantum realm, take a look at light, or let's go back, take a look at electricity. It is tiny, tiny quantum quartz amounts of light that are just pulsating at such a speed that we can't even see the separation. I truly believe between the sun and the soil, we're required both. The nutrients of the soil, the nutrients of the sun, they create compounds like antioxidants, CoQ10, anti-inflammatories, antispasmodics. They create these compounds that are so wonderful. But I was one, like many of us, that we were led to believe that there's only one way that we can get those types of compounds, and it would be through a petroleum-based pharmaceutical. But those recipes are based off of real chemicals that God made.
Yes. I agree.
And the body made, because when these two things come together in the body, we then create other compounds, which is really cool. Anyway, I'm trying to not get too geeky.
Oh, I love it when you get geeky. It's all good. Yeah, because like with the sun on our belly, they say, take your baby out and put them in the sun and make sure their abdomen is exposed for a few minutes so that they can make vitamin D. And that's one of my belief is that sunscreen usage, everybody is afraid to go out in the sun and let the sun hit their skin, and people are deficient in vitamin D.
Yeah.
So sit in the sun for a little while without any sunscreen.
It creates hormones, dopamine, serotonin will be released. It just offers so much. And the chemicals that we're putting on us are then creating another challenge that we don't even realize.
I love that. That sounds like.
And you can create your own sunscreen. If somebody writes me, I'll try to find the actual recipe given by another nutritional company. But it is essential fatty acids, I think it's zinc, and calcium. And you just like your sunscreen, you would apply that every couple hours. You would actually take these nutrients, take them to the beach, take them every couple hours if you're out there all day long. My husband and I have not used sunscreen for years. and we might get a little pink, but we haven't had a real sunburn in a long, long time, not since we've started nutrition.
So that was,
And he's a true redneck.
so that was zinc, essential fatty acids, and calcium.
Yes, if I
Awesome.
remember, but look it up. I'm sure it is on YouTube. I mean, I'm not the only one that, this stuff I learned from class.
Very cool.
But we use it.
That's awesome. I know that Longevity has mineral makeup, and I put that on and went to the beach, and I don't get sunburn on my face. I got burned everywhere else, but not my face. That stuff is amazing. And it doesn't have sunscreen in it. It's just because it's minerals.
Yeah, exactly.
All right. So, oh my gosh, it's 4:14.
Any other questions? We got to go.
I don't really have, I mean, I have the one question, but I think that's going to be a long answer.
Okay.
And ZZ Captain, hi, everybody out there on YouTube and Rumble. He says, yep, they claim we get vitamin D from the sun too. Yep. And okay. I think you already answered it. It was about the other question I had was they wanted to know more about how microcurrent quiets the lung inflammation. Sorry, I'm stumbling over my words. But I feel like you answered that.
Yeah, pretty much. Yeah, we went into that where we were talking about the moving out of the inflammation, the congestion, and then engaging the brain. So that remember the one thing we can do that's a little bit different is when we engage the brain, especially when it's been a long-term chronic condition, at some point the brain kind of sort of said, hey, Ruth Ellen, talk to the hand. We got work to do. It's pretty amazing how much somebody can be contending with, dealing with, and yet they're still able to move forward. It's a little bit of this pilots do it compartmentalize.
Perfect. Thank you.
Mm-hmm.
All right. So any last thoughts that you want to share to wrap it up? All right.
Well, remember, while microcurrent is the signal that quiets, the body still needs all the raw materials for the actual rebuild. And for lungs, we know the secret sauce will be some additional selenium, essential fatty acids, in addition to the essentials.
Very necessary. So Bruce says, thank you, Ruth Ellen and Yvonne. A lot of good information. Thank you, Bruce. And thank you for joining us, Olga. And I put your website on YouTube. And Yvonne can be found at Yvonne 4, the number 4, a better you, the letter U, and then the number 2.com and microcurrentacademy.com. Awesome. Thank you so much. And I can't wait there's a part 3, right?
Yes.
I can't wait. I'm very excited. And we will make sure to have videos.
And maybe we could ask, we could certainly talk about the brain health, and or maybe the eyes. What might the consensus be?
The eyes. We talk about brains a lot, but not a lot of people talk about the eyes. So maybe the eyes and then the brain.
I'll introduce you to some eye docs that are using these tools in their practice, and then we add the nutrition, and it's It's like where we see in other regards, things are really improving. My own eye health is better than it once was. I've shared this before. I'll be sure to actually have my prescriptions on that. But my old glasses were a 4.0 prescription. Then I went down to a 2.5. These ones are a 1.75.
Wow.
Will I ever not wear glasses? I don't know, but clearly my eye health is better. I had 2 astigmatisms, which I no longer have.
That's amazing.
Yeah, and I haven't touched my eyes for about 2 years. I'm not taking the time. Anyway.
Well, thank you so much for joining us today. And if I can get my co-host to join me on screen, then we can do a quick wrap up. And so you guys look for Yvonne at her website for the number 4, a better you, the letter U, and then the number 2.com, and you can they can email you through there, right?
Yes, there'll be a contact us, chat with us button.
Perfect. That is awesome. Thank you so much. Again, I have deep gratitude for you. Just so much.
Thank you. It's been a delight.
Thank you. All right. So today's show was sponsored by dailywithDocandBecca.com. If you would like to talk to a certified holistic health coach, the phone number is 855-949-3377. And if you would like to email us, you can email us at questions@dailywithdoc.com. And this program was for educational purposes only and not meant to treat, diagnose, or cure any diseases. And you guys have options, so explore your options. Watch replays. There's lots of good information. Yvonne has some really good replays on our different channels, which is Daily with Doc and Becca YouTube channel, or is it Daily with, it might be just Daily with Doc on YouTube channel, and then Critical Health YouTube channel, Critical Health News YouTube channel. And then we have several platforms on Facebook as well. And I couldn't do this alone, so I'm grateful for everyone that is here and a couple people that couldn't be here. We have Sherry, who is part of our tech crew, and she helps set things up and helps send the signal out and keeps an eye on the platforms. And we have Mary, who did double time today because she is in Maryland. I know, feel better. Marilyn couldn't make it today, so feel better, Marilyn. So Mary has been our speedy fingers today, and she did a great job. So thank you, Mary. And then we have Albert, who is our gatekeeper, and he lets people in and he monitors things and he picks up the slack where it's necessary to pick up slack. So thank you, Albert. And we have Rod, who was out there on the different platforms helping us out today. And AJ, who is our digital marketing director, he was here earlier and he helps get us out on the different platforms, and he does a lot. We all do a lot. We all work hard at helping everybody that we can to have a better day and feel better. So always remember to be kind. You don't know what somebody's going through. You know, a lot of times you can't tell. So just be kind. And thank you again, Yvonne. And a big shout out to Becca Dukes as well. But thank you. And we will talk about when we're going to get you on the show next. Have a great day, everyone. And we will see you tomorrow. And I forget who our guest is, but we have a show tomorrow. So we're looking forward to seeing you. Take care, everyone.
This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to continue to share the teachings of a founding father of the science of epigenetics, Dr. Joel Wallach, Bachelor of Science in Plant and Soil Sciences, Doctor of Veterinary Medicine, 4 postdoctorates in pathology, naturopathic doctor.